Lacey, Olympia, Washington. I'm going to be creating some exercises and things that you can do, whether it's exercises or stretching, to help facilitate with your care, things that you can do on your own. So I've had quite a bit of patients ask me about that and reference that frequently in my book, where some of the exercises are with my blog articles. But now we're going to put it more in a video format that I can direct you to. Obviously, exercises or stretching is not a substitution for proper medical advice or a trained professional to work with you on that. So I want to at least share these things with you that you can do, and hopefully use common sense when doing it. So the first thing that we're going to be looking at, this is the exercises on a Swiss ball or one of the therapy balls that you see here. You can pick up any one of these at a store or online through Amazon. Relatively inexpensive, usually under $25. You can get a standard ball at about 65 centimeters. And doing these type of exercises with any type of therapy ball is obviously more helpful than just doing a floor-based type of exercise. One, because it engages many types of deep low back intrinsic muscles called multifidi. You have to maintain balance and posture during this. So you're engaging different muscle groups with incorporating types of balance that the brain is forming connections and patterns with. So it's another step in advancing some of your areas of therapy. And an unstable device is obviously something that the neuromuscular system looks to work harder, as well as maintaining the balance in there. So these are the additional muscle groups of being on an unstable surface and doing that. I'm going to incorporate a few that I have from my blog article, as well as a couple others that you can do. You can also look up various amounts online as well, but one to start out with is actually really simple. Just the simple act of just sitting on the therapy ball. And let me get into a better viewing position for you in here. So, when sitting on the therapy ball, you can sit more forward and backward on the ball. Just doing that act can be just a simple way of increasing your core. So maintain at least a proper position that you have a nice arch in your lower back, sitting up nice and straight. You can look forward, chin, and just this alone is a type of exercise to start with. And that the next thing to do is just bring your arms to your sides if you need some balance or need a wall for stability. If you're not certain, get proper feet posture here, about shoulder width apart, and then simply just bring a foot up. So you're engaging some of the core muscles and areas of stability, so a nice imbalance. I haven't done this in a while. As well as doing this where you bring the leg up and toward your chest. You can, if you lose a little posture or positioning like I did, I'm starting to engage certain muscles in that area. You can roll forward just a bit so you feel that, but the idea is to keep your posture. Try to hold that for about 10 seconds. So start out what you can do and grow over time. Do maybe like 3 sets of 10. If you're not able to do that, or like 10 seconds that is, for each of the areas, or for the areas of the back. Let's take a look at the next one I want to do is a position that you lay on supine. So your back's going to be on the ball, underneath your upper back, and bringing one knee to your chest. So I'm fairly comfortable right here. I'm going to bring my arms out just slightly. You can do this. So let's backtrack that a little bit. See if we get a better position and better view on there. Yep, still in here, good. All right, so here's another one that you can do. Bring your arms down, or even bring them back for a little more of a stretch into your back. You can lay your head back. This is one form of testing the stretch with a therapy ball here. Let yourself relax. Do this for 10, 15, 20 seconds. And then you can bring your body slightly forward. Obviously having the shoulders contact the therapy ball, finding a good foot position, and then use the floor for a little balance if you need to. Make sure there's no objects around you, and bring a knee up if you can to hold some type of postural stability right here. So you're engaging some of your core and some of the core stabilizers. And I feel it as well into my leg. Bring it down, switch to the other side, and hold, and up. So you can gently balance a little bit on your back as you're doing this. Hopefully you could see this as well. Now make sure no objects are around you. I said to do the 3 sets of 10 or for 10 seconds. You can always increase that as your confidence starts to build. The other one is to actually lay on your stomach. This is one form of doing the actual therapy ball as well. So laying over the top, you can bring your hands down like this. You can do a little more advanced where you're in this position as well, but start out with where you feel most comfortable and challenge it. So you can simply bring the legs up one at a time, like this, and do the exercise. It's almost like a swimmer's kick. And you're using like 3-point positions right here as well. You can bring your body like this, and then bring the legs up like this to do an exercise. Do 3 sets of 10 with that as well, because you're challenging your core and obviously your balance in there. Another thing to do is just stretching over the top of the ball for your lower back, just like this. So you can feel a nice traction and pull as I do in there. And then you can also do and bring out opposite arm, opposite leg to challenge your back, just like this. You're almost doing like a cross movement where the left leg and the right arm reach out, and you can raise your head slightly doing that. 3 sets of 10 as well. So this gives you a little bit of ideas of things that you can do when doing some type of exercise with a Swiss or a therapy ball that can help stabilize your core, but even more importantly, stabilizing your areas that need adjusting or that have been adjusted in that. So I'll do some other stretches and exercises as well, but this was a good starting point to share with you guys. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. Thank you for watching, and look for some more of our videos. If you need some more information, visit our website at drdavidwarwick.com. See you soon, guys. Bye-bye.